Now, in the last few years, we've seen interest in passing bills around universal healthcare here in Colorado, but that ultimately got to committee and did not make it past that. And so, this is one of my favorite types of bills, which is an analysis and information gathering bill. So, rather than fighting again on some of those points brought up, the idea here is to put some time and money towards the study of these topics, and so our state legislature can better understand the impacts that a bill or a series of bills can have. And so, HB 241075 is an analysis of universal healthcare payment system concerning consideration of a statewide universal healthcare payment system, and in connection therewith, creating an advisory task force for the purpose of advising the Colorado School of Public Health in conducting an analysis of draft model legislation concerning a statewide universal healthcare payment system. And so this tasks that School of Public Health to work on a bill and understand the impacts that this will have for Coloradans. And it gives it a due date of October 1st, 2025, which would tee up a bill for 2026 for creating a universal healthcare system. And the amount of friends and people I know of personally who are going through medical emergencies or who have had to make decisions based around medical insurance, for example, staying at a job that you're not passionate about but provides health insurance to your family or self. And just the number of people who can end up with these medical bills impacting them for years to decades. I think we're really selling out in a way to these insurance companies who are making profit and on the backs of medications and procedures and things that should be covered. Other countries have figured out how to cover. Even as a country, we give federal aid to countries that have universal health care, but are ourselves still using a system where if your job does not cover it and you don't get it through your state, could find yourself in one of these tragic situations. And we have some state programs for people depending on age and circumstance. And I think if we were to pass something like this, and if we were to pass the bill that gets brought up through this process, we would be a leader in the US, and who knows what that might lead to others using our study and others implementing similar programs, let alone be this attractive aspect for business and potential here in Colorado. Create the task force to help to figure this out. But the bill is not yet. We don't have a committee date yet, so we're still waiting on the next steps. But we do know that it's going to the Health and Human Services Committee. So if we click on that, which I guess I made a new tab. I got distracted for a second. you can look at the members of this committee. And so, even though we don't know the exact date that this is going to come to committee where you can give public testimony and share your voice that way in personal stories, you can already begin to email the people on this list, like bill sponsor Karen McCormick, who, because she's a bill sponsor, will be in favor, but you can still get her email and let her know that you are in support and that you're thankful that she's bringing this bill forward. And then you can go through this list, get the emails of all these members, and submit your written comments. And we will be watching for when this bill specifically goes to that committee. And that is what we want to talk about on the healthcare side.